So it's my great honor to introduce my colleague, co-principal investigator for engagement and for ethics, who's been a guiding light on this project. And I would love to introduce her and let her tell you more.
Thank you so much, Eli, and it's a pleasure to be here. Could please advance it to this slide. So as we've heard before, it was really important when we were starting to design CA Notify for the UC campus that we would design it so that it would be acceptable, that people would want to use it, that they would adopt it. And how do we get there is not a straightforward process. However, we used human-centered design as a process. And so when we first learned that we would be pilot testing this exposure notification tool, we started to engage with people in our community, in our local university community. And we did this through a design lab process. You know, we were part of a speculative design series of presentations, but in reality, this wasn't speculative. We really needed to know, what would our students think of this? What do our staff think? And what do our faculty think? And we did that through a workshop, and we learned about barriers. We learned about facilitators, what would excite them about using it, what would be an absolute no adoption. So we did a lot of listening, and that started in September. We continued in October and used these workshops to start iterating on our communication, which ultimately became part of what was launched on December 10th, 2020. Next slide, please. One of the things that I do as a research ethicist, especially with my work in digital health research ethics, is I want to think about whether or not we're designing these tools for adoption, for trust. And so we also applied this ethical framework in thinking through how we were designing the CA Notify system. So we wanted to make sure it was acceptable, accessible, and usable, that we really had privacy at the forefront, that we were very conscientious about data management and sharing of what data there were, and that we were really thinking through the risks and benefits and how to communicate those. Next slide, please. So after we did our local campus community workshops, that was in the fall of 2020, we observed what was happening with uptake between December and April. We decided we needed to speak to more people from our communities. And so we hosted 3 additional workshops. One was with youth in the City Heights area. The other 2 were with monolingual Spanish speakers that were located in Chula Vista, California. What we learned from them is that they wanted to see fewer words. They wanted us to put privacy up earlier in the communication. They were really excited about sharing this information with their communities, but they were a little bit worried. They didn't understand how Bluetooth worked. They were not sure if somebody could take information from their phone. So we took this information and we went back to our design team working with Google and Apple to identify how can we convey this information about Bluetooth. And there were a lot of different things that the community shared with us that we immediately started to implement into the communication of CA Notify. Next slide, please. So this is just an example of when we took back the concern about Bluetooth, the Google and Apple teams came back with information about how can we make this look, what words can we use? And then we took this back to the community and asked if this helped make it more accessible, more understandable, less threatening. What we did find out during that iteration is that they didn't care about their battery. They just really cared about whether or not information could be taken off of their phone if Bluetooth was on. Next slide, please. So this is just a picture showing where we were in fall of 2020 at pre-launch, how we took these images and through workshops and surveys continued to iterate until we launched in December 2020. And then our current version is under the current column. And this is basically where we are today following the feedback that we've received from more Californians. Next slide, please. We continue to engage with the people of California. So when they get an EN, they are able to go to the website and answer a survey. And what we're learning is that 81% are willing to recommend CA Notify to others. They're 84% are willing to share their location, which is something that we really didn't want to have as part of our first iteration, because we were worried that people would think location was just too sensitive. But they're willing to share their location with the health department to make it more possible to know where there could be infection spread. 72% said they were confident in the effectiveness of CA Notify, and 91% found the information useful when they went to go find what to do next after receiving the EN. That really is helpful to know in terms of our communications and how we're communicating with the public. Next slide, please. Once receiving the exposure notification, 73% said they were going to begin to watch for symptoms. 58% planned to get tested. 11% reported that they were already experiencing symptoms. And like what Eli said, if I had a scratchy throat, I may not think it's anything other than an allergy, but this then tells me I better do something more intentional about getting tested. 90% of these EN recipients had not yet been contacted by a traditional contact tracing outreach. Not to say they won't be, but this EN system got to them first.